So moving on to the last one on innovation, it's DrAssist.
Hi, good afternoon. I'm Devarati, founder of DrAssist Cancer Care Intelligence Technologies. We are trying to solve the cancer care problem by developing an intelligent software that's going to run in the cloud. It's going to assist cancer care professionals like radiologists, pathologists, and oncologists during their diagnosis and treatment processes by delivering precise diagnosis and personalized cancer treatments for the patients. I got a small question for you. Do you know the casualties that have happened in the World War I? Anyone can guess? Sorry? Yeah, I think I'll give one gift for you. Probably, right. If you see the statistics, what I'm talking about, by 2030 probably, the statistics what we are seeing are going to be reflected across the globe, which is nothing but we are going to see another world war coming in directly or indirectly towards us. But don't worry, we are going to be as saviors and we are going to save the world here. Right? And when it comes to the one of the aspect that what we are looking at is the cost is, right? It is almost touching 1.5 global GDP, which is a very whopping amount, so we have to be very careful there. We have seen a lot of issues when we are trying to analyze the problem where the issues are really happening, but we have really figured out 4 major problems here. There are 30% of diagnosis errors are happening, which is very dangerous. And if you see the standards-based treatments across the globe, only 60 to 70% of the doctors are following standards-based treatments. And we have very, very less care experts, which is very, very alarming. And overnight, it is very, very difficult process for us to produce care experts. And we are talking about number of doctors available. It's very, very scary. And I'm talking about this is about developed countries, and you can think about developing countries like us, and you can think about undeveloped countries. The situation is going to be worse. I found one of the doctor from Tanzania last week in a Global Cancer Summit. He claims that he's the only one oncologist across the country there. So now you can understand how severe the situation there. But if you observe the systems, I don't see much improvement in terms of cancer care for last 50 years. We have eradicated polio, and we are seeing significant results in terms of controlling the cardiac arrest, but the cancer still remains the same, even though there are slight improvements, but I don't think so there is tremendous progress there. That's why we are trying to come out with a software that's going to run in the cloud, where doctors can use it and perform the diagnosis through automation completely. It's a simple 3-steps approach. Somebody wants to perform the diagnosis, either radiologist or pathologist, they can submit the images, and we are going to come out with the cancer diagnosis results instantly. That is a complete tumor story about shape, size, and the stage, etc. Once diagnosis is done, now I'm talking about the treatment. Now oncologist can use our software along with the output that what diagnosis has given out. He can frame out personalized cancer treatments which are specific to the patient, which are evidence-based and standards-based especially. That's where we are trying to see a lot of errors can be minimized, and we can save millions of lives there. And third aspect, what I'm talking about, discovering the medical knowledge. Out of 100 doctors, what we have, only 20% of them are experts. But on an average, to become an expert, doctor takes 20 years. But we wanted to reduce that. If a doctor can use our system and he can become an expert within 5 to 10 years, I think that's going to be an amazing aspect there. So the impact is going to be incredible here. Wanted to achieve 100% preciseness in terms of delivering the diagnosis and treatment. Wanted to reduce the price. If we could reduce 30% of the price, I think we are going to save billions of dollars there. And one of the aspects, what I'm talking about, performance here. If we could accelerate the doctor's performance, there's a difference here. We don't want to rush the doctor. There's a difference between acceleration and rushing there. If we could really amplify them, right? I think it's going to be huge impact in terms of treating the patient there. The last aspect, what I'm talking about, power. This is one of the goals that we have in our vision model. By probably next year, we wanted to give some power to the patient also, where patients can become as a participatory aspect of the system. Right? The value is, for the patient, is going to be affordability, accessibility, and quality. For the doctors, it's going to be amplification, accelerate their process, give the accessibility from anywhere, need not to be in metro cities. From anywhere across the globe, you can start using our software. And we wanted to transform cancer care centers to cancer care excellence centers. And we have been working with 2 hospitals, and we see there's going to be a lot of tremendous requirement for this sort of systems, which we are foreseeing. I think probably next year we are going to have 2 more hospitals.
DrAssist gives additional information and inputs to the doctors. If the doctor can give the clinical findings, the images what they have, they will be processed and proper diagnostic confirmation and staging can be given, and based on that, proper treatment plans can be evolved from the system. An ideal solution can be given for the doctor at that place of work, and he can compare and implement as per his requirement, as per the needs of the patient. With that, they give uniform health care all over the country or the world.
Thank you. This is our team, and we have around 8 to 10 members team working on this, and we have another 2 years to make another next level of product here. But as of now, we are restricting with 5 to 6 cancer types, and we are in talks with a few more hospitals which are getting implemented in next couple of months. And we are trying to make it open through the cloud by March of next year. Thank you.
Yeah, that was a very exciting vision for
Thank you.
cancer.